Welcome, everyone, and thank you for joining us today. I'm thrilled to introduce a key conversation about tobacco harm reduction, a strategy with the potential to drastically change lives by helping people who smoke transition away from combustible tobacco. Today, we have two renowned advocates in the field joining us to explore this topic. Kurt Yeo, co-founder of Vaping Saved My Life in South Africa, and Martin Cullip, an experienced policy analyst with the Taxpayers Protection Alliance based in South London. Together, we'll explore the key issues surrounding THR, focusing on how alternative nicotine products like e-cigarettes can offer people who smoke less harmful options and provide a viable pathway to reducing the global burden of smoking-related illnesses. Our goal is to shed light on the challenges and the potential that THR holds, particularly in regions facing strict regulatory measures that risk limiting access to safer alternatives. As policymakers around the world weigh the future of nicotine regulations, it's more important than ever to separate the misconceptions from the facts and understand the science behind harm reduction. We hope this discussion will provide valuable insights for decision makers and advocates alike as we work towards a balanced approach to tobacco control. Thank you again for being here. So, Kurt, if I can ask you, can you maybe give us a brief overview of the current tobacco control bill in South Africa and highlight how it impacts tobacco harm reduction efforts, particularly for e-cigarettes?
Well, thank you very much, Brian, for the invitation. And hi, Martin. Good to see you again. Yes, so currently the proposed Tobacco Products and Electronic Delivery Systems Control Bill, take a deep breath, was introduced to South African public in 2018. It's now sitting in Parliament, and obviously, as we all know, South Africa has just recently gone through an election, and it moved from the 6th administration into the 7th administration, and in that process, it had skipped two provinces for public participation. So this last weekend, we had our 8th public participation, and that was in the Northern Cape. And this coming weekend, we will be having it in KwaZulu-Natal. Effectively, the bill, I mean, we need to just be quite honest here. I and VSML are not against regulations. We believe strongly in regulations. The regulations, however, need to be based on evidence and the science. And unfortunately, what we see in this bill, that there is no distinction between combustible tobacco or regular tobacco and new nicotine products like vaping products. There's no distinction whatsoever. The same regulations that will be applied to tobacco products will be applied to vaping products. Those are things like the complete and utter ban of advertising and promotion. There will be display bans. There will be bans on internet sales. There will be ban on the couriering or posting of products. There'll be bans on what you can and can't say about these particular products. And even if you look quite deeply into the bill, there might even be further plans around the components of these products. So now we're looking at, for example, flavor bans. But more importantly is that there is a section in the bill that provides the Minister of Health unfettered powers to make regulations without any further consultation. When it comes to the use of these products, the same issues apply. There will be banning of vaping and smoking in indoor public areas as well as certain outdoor public areas. There'll be bans in certain scenarios within your own personal residence. So, for example, if you have your own personal residence is used for commercial activity, whether it be for child minding or whether it be for domestic work, you are not allowed to smoke or vape in your house because now it's considered as a commercial activity. And then on top of all of this is that any of the breaches or any breaches of these regulations could face you anywhere between 3 months to 20 years in jail, depending on the offense that you commit. So it's a rather draconian law, and it's a rather poorly written law in the sense that it does not distinguish the very clear difference between combustible tobacco and vaping products.
Wow. Yeah, so I do know that they specifically say that it's not prohibition. Um, it's not banned exactly, but Martin, if I may ask you, do you believe that heavy restrictions on e-cigarettes, which some might then call a soft ban, could lead to unintended consequences, for example, on how this might affect current smokers trying to switch to safer alternatives?
Well, yeah, most definitely. I mean, uh, you know, these products are vastly less harmful than smoking. I mean, that's without question. And we see sort of two different kind of approaches, the way governments across the world are handling it. Some are thinking, well, look, we can see the benefits here, that, you know, perhaps we should somehow promote these products, which is happening in places like New Zealand, where their smoking rates had a dramatic decline, a huge decline very quickly when they embraced vaping. The same happened in the UK, although the current UK government is more cautious and is planning to restrict things more, which I think will only lead to bad consequences. And then you have the other types of country, like, you know, Brazil, which have banned the products. Argentina has banned the products. You know, these things might change in the future, but South Africa seems to be going that way, down the route of extreme caution to these products, which is really disappointing when you consider that they say, yes, we realize they're less harmful than smoking, but they're not risk-free. And they say they're not risk-free. No one's saying they're risk-free. There may be risks in the future, but I sometimes call it hysteria, the way they panic about these products, when as yet there has not been any tangible harms identified after 20 years since they've been invented. So what you're going to have is, as far as I see it, the South African bill is going to plan to treat vaping exactly the same as smoking. So if there's a toss-up between the two, and people will use nicotine, if there's a toss-up between the two, they're just as likely to go to smoking. In fact, probably more likely to smoke, because it's the easiest option of the lot, than go to something that's far less harmful. So you'll see a chill on people consuming safer products, and people carrying on smoking or taking up smoking when there are safer options available. It doesn't make a distinction between the two, as Kurt said. So the only thing that will happen with that is people will be cautious about taking up vaping. And when the two are about the same, treated the same, they think they're about the same risk. And it will just, you'd have higher smoking rates than you otherwise would if you treated these products less stringently than combustible tobacco.
Yeah, I know particularly the current tobacco control bill set standards for manufacturing, specifically for these points. However, in South Africa, we have experience in such strict regulations that they do tend to unravel and move towards the black market. Kurt, if I may ask, what are unique challenges that South Africa faces in implementing effective harm reduction strategies compared to other countries?
Well, yeah, I mean, if we look at, for example, South Africa was the belle of the ball in the late 90s in terms of the regulations. And then in the early 2000s, we became one of the very first countries in the world to sign the Framework Convention of Tobacco Control. But since then, South Africa has pretty much done very little in terms of addressing tobacco and tobacco consumption. And in the last decade, we've seen tobacco growth, or the use of tobacco, go to points where we are long before the 2014 or even 2010 figures. We're now sitting around about a third of the South African population have used tobacco products or currently using tobacco products, including e-cigarettes. So with regards to the challenges that face consumption or reducing tobacco, is that the only thing that the state relies on is either heavy excise taxes or regulations that are just a blunt instrument to prevent, blunt instrument on the industry as well as its consumers. But we don't talk about the control, the demand reduction with regards to Article 14. So there's no cessation support, smoking cessation support in South Africa to speak of. We don't provide to our public through the public healthcare system things like NRTs or any pharmaceuticals. We don't provide them with counseling or support. And the other thing a big issue in South Africa, as you highlighted or alluded to there, is that we have an incredibly robust and growing illicit market. Currently, it's estimated around 60% of all cigarettes consumed in South Africa are illicit. And you can get, for example, a pack of 20s for as little as 12 Rand 50 for a pack of 20. Now, we also need to look at, for example, the social economic situation in South Africa. South Africa is the most unequal society in the world. So there's very, very many people who are predominantly, who are people that smoke, are in a social economic environment or situation where they would not be able to afford any kind of support. So they have to rely on something like cold turkey, just quit or die. And unfortunately, that's very unsuccessful. So I'm not under any delusion that vaping is a silver bullet in South Africa. However, this bill clearly indicates that there is no appetite for a conversation around harm reduction, because there's a whole host of other products which could perfectly suit the South African environment, like nicotine pouches. But the mindset of lawmakers and health experts is that any harm is harm, irrespective of a or spectrum of harm. If we know that cigarettes are incredibly harmful and they sit at one side of the spectrum, and we know no consumption whatsoever is on the other side, we've known for many years that things like nicotine replacement therapies all fall into that section of harm right next to no consumption at all. And e-cigarettes and nicotine pouches are more in that area. But unfortunately, the language you're getting is that any harm is still considered as harm. So the biggest challenge with aphasia is just an acceptance that we need to be more pragmatic in our approach in reducing smoking, that South Africa doesn't have the capacity to implement or enforce any of these laws. Because in 2020, when they enforced the sales ban on tobacco and vaping products as well as alcohol, we saw the illicit and black market explode. And very few people took the opportunity to quit. And then when we researched it after the ban, we noticed that many of those individuals went back to smoking anyway. So we need to be very, very mindful that, this should be consumer-centric, pragmatic, and meet people where they are at, rather than just bashing them with more regulations, more excise, and knowing full well that we have a track record that's completely failed.
Can I just add to that? This comes from a sort of like tragic conceit, really, from governments, that if they sign a bit of paper with words above it saying that you're not allowed to do this or you're not allowed to do that, that automatically eradicates the problem they're trying to eradicate. That's obviously not the case, especially when you have a product that is in much demand, like nicotine. Nicotine has been used by human beings for 12,000 years. And anyone who actually, sorry, I've got a cat on my desk here. Anyone who thinks that you're going to eradicate nicotine use is really living in cloud cuckoo land. It's just not going to happen. So what the goal should be is, well, accept these people. So people will use nicotine. It's a drug that many people use in every country around the world, and like I said, it has a long history. So the goal should be, how can we get our public to use nicotine in the safest way possible? And the laws that are being planned in South Africa don't do that at all. They treat both exactly the same. So why would you want to place such burdens on the safer product when you know that one is much more harmful than the other?
But it's not only that. If you think about it, the 2021 Global Adult Tobacco Survey, which was the first and only one that we've done in this country. So we don't even have any mechanisms to measure success or failure in the country. That's problem number one. But in that particular data set, what it was discovered was just over 30% of South African population even knew about e-cigarettes. And when we looked at the data itself, only 2.2 of the people that responded to the survey had ever used an e-cigarette. So this is really not an issue. But when we look at smoking, smoking is a significant issue in South Africa. As I've said, we're now looking at close to 30% of South African population that use tobacco products. But only 30% of them, or just over 30% of the people they surveyed, even knew about an e-cigarette. And then again, we look at individuals that can't afford these products, but it's in our infinite wisdom, we then slap an excise on these products, making it even less affordable to many South Africans that were using these products to stay off cigarettes. So again, it's just regulation, legislation, excise, but there's nothing pragmatic about addressing the situation. We can all agree that we do not want the youth to pick up cigarettes or vaping products or any other risky product. Unfortunately, they are going to, but we should put measures in place to prevent that. But we should not ignore close to 11 million South Africans that are smoking that will be facing things like cancer, heart disease, lung disease, and you name it, because all that's going to do is add more pressure and more burden on the state, which is already buckling under all the pressure.
Absolutely. I know it's a very sensitive topic, but it is much better for public health. Look, youth picking up smoking is not a new thing. So in order for public health to gain, well, to improve, picking up or starting with something less harmful that you can also climb off of pragmatically in stages and everything, it's also much better for them to start with something lesser than most harm comparable.
So the interesting thing here, Bryan, is if you look at, for example, the Fourth Amendment of the 1993 Tobacco Bill, which indicated that they would increase the age restriction of the sale and supply of tobacco products from 16 to 18. If we look at 2012 statistics that were conducted in a national survey, that particular cohort between the ages of 15 and 24, which I still don't understand why we use that particular age grouping. I would much prefer that we follow the likes of the National Youth Tobacco Survey in the United States, where we actually look at the youth. 24s should not be considered as youth. But anyway, that's the bracket we're working with. So 15 to 24s in the year 2020, in 2012 was around about 12.8%. In 2021, that same cohort was at 23.9%, even with regulations in place. And what's more interesting is, as you see this climb of youth vaping as well as, youth smoking, as well as smoking overall, it almost parallels the strength of the illicit trade. So we're not only are we not been able to enforce the underage of taking up tobacco, but we're unable to enforce the illicit as well. So, I find it rather offensive that we look at scientists that come up and say, well, it's the fancy colors, it's the fancy, the fancy packaging, it's the fruity flavors and all that. When we actually see it on tobacco itself, it's got nothing to do with that. It's the fact that we are unable to implement and enforce the laws that we put in place. So we're going to have kids having these products unless we have a very pragmatic approach on how to deal with it. You can't just put it on a piece of paper, as Martin says, and think that it'll go away. It requires management, it requires measurement, and it requires an involvement between the industry and consumer activists, as well as the consumers, as well as the health individuals, to work out on plans to ensure that we protect the people that we intend to protect, but also assist the people that really do need assistance.
Yeah, exactly. Martin, if I can ask you, how can policymakers balance regulation with access to reduced risk products to ensure that they are available to people who smoke, seeking safer alternatives without compromising public health goals?
Well, the first thing they should do is what I said in just now, is accept that nicotine is going to be around. You're not going to get rid of it. It's as simple as that. Just like alcohol has been around for thousands of years. They don't think we're good. They say we'd like to stop harmful drinking. You know, we don't want you drinking yourself into an early grave, but they don't go around saying we need to crush alcohol and get rid of it, because they know it's not possible. And they have to firstly accept that nicotine will be used by people. It's not going away ever, and literally ever. Then once they establish that, then obviously the next path is, right, how can we minimize the harms from nicotine use? And that's what most governments are not doing at all. They're having this big, you know, screaming with their arms in the air about, oh my God, people are using nicotine. People use caffeine. It might surprise many people to know that there was a 300-year battle for acceptance of people to use caffeine, to drink coffee. So these things have always happened. We've always had innovations come in, and you have people that are terrified of them and they come up with all these wild excuses as to why we've got to eradicate this product. But at the end of the day, humans will use it. And it starts with that basic acceptance of that premise, because you can't craft decent policy if you're not even understanding what's facing you. You know, in the UK at the moment, there's quite a lot of worrying about youth vaping, and the British government is coming out with some laws that are going to be highly counterproductive, and all of it is crafted around the idea that we need to stop youth from vaping. But in the UK, twice as many youths are regularly drinking alcohol. But there's no furore about that. It's kind of just accepted. Well, you know, that's what kids do. Well, this is the same. This is what kids do. What you said, Bryan, monkey see, monkey do. They see adults using it. They aspire to be adults, and they want to copy it. Sometimes it's a fad. Sometimes they'll get over it. Other times they'll go on to regular use. But you have to understand that these things are going to happen with kids, and you can't just throw all these products out because children are using them. You have to come up with some sort of sensible policies that does try and stop youth from using these products, but without taking away from the adult population, especially when it comes to something like vaping and nicotine pouches and you know, low risk alternatives to smoking, because you don't want to put such restrictions on them which stops kids using them, but then also stops the probably 10 times more adults from using them, especially if they're currently smoking. So I think it stems from that acceptance. Politicians have to accept you're not going to get rid of nicotine use. Nicotine is not comparable to combustible tobacco. I think there's a conflation there as well. They think nicotine causes all the harm, but you know, do reading up about it. Like Kurt said, if they speak to industry or speak to consumers, and then we can advise them of that. So you do realize that nicotine isn't the harmful product in combustible tobacco. And so if they had an understanding of that, if they understood nicotine's not going away, if they understood the problem with smoking is not the nicotine, then perhaps we might see some more sensible policies coming from certain countries.
Bryan, I just want to add to that, is that South Africa is no stranger to this principle of harm reduction. In the early 2000s, actually the late 1990s, we had an enormous issue around HIV and AIDS. And we started off the conversation around HIV and AIDS in those years about completely denying it, that it doesn't exist. And then we went on to treatments like African potatoes, beetroots, and garlic as a treatment. And eventually, when the world looked at South Africa and said, "Oh, you got to be kidding, you're making the biggest mistakes." At the same time, the premature deaths were estimated over 300,000. We lost, I don't know how many tens of thousands of babies because we did not act according to what the evidence and science is saying. Eventually, we turned the corner and we put in a program where it looked at things like providing education, providing ARVs, and even providing free condoms, not only to the adults, but kids in school, because we kind of realized that it's not going to stop. People are just not going to stop. So what measures do we put in place to limit or to reduce the harms? And things like education, absolutely vital, particularly in our schools environment. Issuing out free condoms was a major step. And we even went as far as, and I've got a video clip of President Cyril Ramaphosa when he was a deputy president, holding up the new variations of condoms in Parliament that came with flavors and colors and so forth. And it's quite ironic that we accepted those kind of principles of harm reduction and consumer-centric solutions in those days. And now we just kind of, when it comes to tobacco, it's quit or die. And if you continue, then expect to pay more and incredible restrictions where you can only use these products right at the end of the driveway or in the field somewhere, and that's it. We do not look at these problems with any level of pragmatism.
Yeah, I think that absolutely reiterates exactly what Martin also said. The problem is not necessarily going to just go away if you tell them no. It's accepting that people are going to do it, and by giving them harm reduction products, you don't necessarily encourage the act of it, but more the safer policy of it, the safer way of doing it. And absolutely, I know that it helped and decreased. And for policymakers concerned about the potential risks of e-cigarettes, what would you say are the key differences between harm reduction products and traditional combustible tobacco?
Well, I think they've got to realize that the easiest way of smoking and the most efficient way of getting nicotine is a combustible cigarette. I mean, that's just a fact. So every time you sort of lay any sort of restrictions or impediments in front of vaping or heat tobacco or nicotine pouches, all of which are much less harmful, you're going to nudge people towards cigarettes because that's the best product. I mean, you can get a huge burst of nicotine into your lungs in less than 5 minutes by smoking a cigarette. The other forms of nicotine consumption, like vapes and pouches and other things, they are far less efficient. It takes longer for it to get into the bloodstream. So it's always going to be something that is going to be a learned practice, if you like. So every time they place a restriction, they're basically cheerleading for cigarettes. That's without doubt. You're just saying this is hard to do already. You know, it takes a while for some people to get used to vaping products, and nicotine pouches even more so because the release of nicotine is much slower in nicotine pouches. So all the time you're putting restrictions on those products, you're just making it easier for people to smoke, and that's where all the harm is. We know this. You know, there's this argument people always say, "Oh, we don't know the long-term effects." Well, we know the short-term effects, and the short-term effects are drastically less harmful than cigarettes. The long-term effects we kind of know already anyway, because we don't know everything about vaping products now and what might happen in 30, 40, 50 years time. But people obviously say that thinking, but it took us 50 years to work out the harms with smoking. Yes, but that was with the 1950s technology. Are you saying now with AI and computers and mass spectrometry and everything else, we don't know the consequences in the future? We have massive databases now on every chemical and molecule on the planet and what harms could happen when one interacts with the other. It's rather Luddite, really, almost like Neanderthal to say, oh, we don't know anything about them. In this modern day and age, we can predict with technology these days what will happen in 30, 40, 50 years time. And this is why, you know, public health researchers who've looked into this in depth have said we are very confident that these products are going to be increasingly less harmful than cigarettes for a very long time. I mean, we're into 20 years since they were invented now, and there's not yet one verifiable death worldwide of someone who's died of vaping a regulated product. So as the years go past, you've got the old gravedigger there sitting with an empty hole waiting for the first person to die from this stuff. So it's a bit of a nonsense argument. So they have to, you know, the differences are massive between these two products, as any consumer will tell you. And again, it's about time governments started speaking to consumers more regularly than they do, because we can educate them, we can tell them our experiences, and we can hopefully highlight, you know, what is actually happening out in the world, rather than what they're being told by people with vested interests and their assumptions about something which many governments don't really understand anyway. They need to understand the product. They need to understand nicotine use will always be here. They need to understand the massive difference between the two and stop putting impositions on the safer product.
Yeah. Or if I can also emphasize, I used to work in the consumer side of it. I used to work in a vape shop, and every client that came to me that asked me to help them get a device and everything set up, 7 out of 10 times. So how you explained it, it's learned behavior. 7 out of 10 times, everyone coughed. after after their initial drag, and like, oh, okay, well, you know, now then they immediately feel it's not for them. However, it is a learned behavior. It doesn't work the same as combustible tobacco.
So
I have to reassure them, absolutely, just go on. It will get better, and you do feel better for it.
the reality is that in 2020 and 2021, we established a brand new technology called mRNA in a vaccine. And it took us 9.5 months in order to establish a vaccine, test it, and then roll it out across the world at enormous pace. But there's another very, very good example, and that's a product called Ozempic, which is used for type 2 diabetes. And it's also used for obese people. Now, Ozempic, interestingly enough, the first time it was actually brought into production in terms of testing it, development. The first time it was actually used in the development was in 2012. The FDA finally approved this product for release in 2017. That's 5 years. That's 5 years of data and information that they're able to receive from development to release to be prescribed to people with type 2 and obesity. Type 2 diabetes is not an acute disease. It's a chronic disease. So Ozempic would be needed for the entire life of that particular patient. But they kind of knew what they were getting into within 5 years. And as Martin's correctly stated, we've been doing this for 20 years. I've been vaping for over 11 years now, and my health is better. And I'm very fortunate. I live with a medical specialist. So, you know, when somebody makes that statement, I agree with Martin. In that case, do yourself a huge favor. When you go to the doctor, don't accept any of the latest antibiotics. Don't accept the latest MRIs or the CAT scans, and maybe look at an antiquated X-ray as the only thing available to you, because we have such precise and sophisticated medical equipment and diagnostics that it's frightening. And we've clearly been shown that from a biomarkers level, these products are significantly different to a person that continues smoking. So I'm frankly running out of patience when people talk about we don't know the long-term effects. Please do me a favor.
Yeah, these days you put a product into a little machine called a mass spectrometer, and within seconds it comes up and tells you what's in it in little spikes, so you can see it on a computer screen. When they were assessing the dangers of smoking, the doctor study from Royal College of Physicians back in 1962, they sent out letters to people in the post, and they filled in a questionnaire, and then they put it in an envelope, they stuck a stamp on it and sent it back. And then these scientists trawled through all these things, and they had to do this over and over again to do follow-ups and everything else. So the report was released in 1962, but this was after a decade of going through these things or more. So you're talking about 1950 science. That's 70 years ago. They didn't have computers. They didn't have anything we've got now. They were using paper and pen and envelopes and stamps. So to say that it took 50 years to find out the dangers of smoking, so therefore we got to wait 50 years now with all the technology we got, is pretty absurd thinking, isn't it? It's just nonsense.
Yeah, it's absolutely crazy. And, you know, it just blows my mind is that when it comes to this particular product, we kind of lose all reality in terms of what can and can't be achieved within our modern age.
It's a very, for the people who are promoting this, you know, to try and, you know, attack vaping, it's a very simple concept for the public to understand. That's the thing. They think, oh yeah, smoking took 50 years. It must take 50 years again now. But yeah, if you point out to them, but what other things do we not have 50 years ago? Look at the difference between our life now and 50 years ago. I mean, 50 years ago, you wouldn't go out without a hound, you know, things like that. Life has changed, science has changed, everything has massively changed since 50, in fact 70 years ago now, 60, 70 years ago.
We could literally ask them to take away their microwaves, take away the air fryers, and, you know, bake their bread in the ground with hot stones, you know. So I mean, the reality is that it's just an absolute lazy argument.
Absolutely. But Kurt, you also earlier touched specifically on one word that I had in mind was biomarkers of exposure. And It's exactly the biomarkers of exposure that are measurable indicators in the body, like metabolites that can reveal how a person is being exposed to certain substances like tobacco and nicotine. And these technologies specifically have evolved throughout the year, and that can specifically tell us exactly how it could be. And well, that's how we measure the risks of it.
Modern medicine's been using these particular technologies for the longest time. When you go for blood tests and blood results, when you do saliva or any other secretion tests and that, it provides a lot of wealth of information for the doctors to introduce some kind of management program in order to address the situation they saw in that biomarker. This is not new stuff. It's very precise, and it's getting more and more precise every single day. But it's something that we've been dealing with or using for quite some time now. And unfortunately, when it comes to discussing tobacco, suddenly our knowledge of this kind of technology, our knowledge of how to manage people with in this environment is suddenly lost. We expect it to now think back into the 1940s, 1950s, and that's where, once again, smoking and people who smoke are now renegated to the 1940s and 1950s. They are not worthy enough to deal with modern innovation, modern research, modern approaches. You need to push them back into the dark ages, because that's how we dealt with smoking.
As we conclude today's discussion, I'd like to express my heartfelt gratitude to our speakers, Kurt Yeo and Martin Cullip, for sharing their insights and expertise on tobacco harm reduction. This conversation has underscored the crucial role that informed, balanced policies can play in shaping the future of public health and supporting people who smoke and finding safer alternatives. We hope today's session has provided you with a deeper understanding of the science and purpose behind THR and illuminated the potential positive impact that accessible, affordable, and acceptable alternatives to smoking can bring. For policymakers and health professionals who are watching, we encourage you to carry these insights forward and consider how THR strategies can complement existing tobacco control measures to better serve public health. Thank you once again for your time and engagement. And together, by standing informed and open to new approaches, we can make meaningful strides towards reducing the harms associated with tobacco use and ultimately improving lives.